Hi, and welcome to the Wayne Lamos podcast. I'm your host, Wayne Lamos, continuing with the mini-series Let's Make Psychology Common Living Culture. Here we are on episode 4, Coping Skills for Anxiety and Anxiety Disorders. Here I'd first like to start by saying that coping skills help a great deal of people around the world who would have suffered otherwise without them. However, we have to realize that they are temporary relief and are not a permanent solution. This you'll understand by the end of this podcast. The best way is actually with a mental health specialist and with guided therapy and or a psychiatric help where you may need medication also. And also with coping skills, what you have to realize is that it's practice, practice, practice. You have to train your brain and train your body at sometimes. Your brain at sometimes has to rewire. That has to be realized. And also nutrition. Nutrition is extremely important in this. It goes hand in glove, like I've said before, it's part of the pie chart. Moving on. So we're going to be looking at skill 1, which is breathing techniques. Now most of the breathing techniques talk about breathing slowly. So let's understand this so we can just talk about any breathing technique after that. So just remember brain stem and neocortex. Remember sympathetic nervous system and remember parasympathetic nervous system. And remember alpha wave power and remember theta wave power. Okay? So what you have to do is basically you're looking at a switch from the brain stem function to the neocortex. You're looking at a switch from the sympathetic nervous system to the parasympathetic nervous system, and you're looking at a switch to alpha power from theta power. So that's what happens when you slow breathe. When you slow breathe, and it has been found in EEG studies that there's an increase in alpha power whose role is inhibition of task irrelevant networks and timing within task relevant networks, and a decrease in theta power which is linked to arousal, active cognition and attentiveness. Now, breathing techniques may vary. Some of them generally go around the lines of you breathe in, taking 4 to 5 seconds, you hold that breath for 4 to 5 seconds, you breathe out for 4 to 5 seconds, and you hold your breath without oxygen for 4 to 5 seconds, and you repeat that cycle about 4 to 5 times, or till anxiety goes down, or you can use an exercise to get yourself used to it. Other people might say you're breathing out and you're holding out without oxygen, could be 6 or 7 seconds. But once again, we understand the principle behind that over there, so whatever works for you, I guess. Moving on to skill number 2, which is grounding techniques. Here we're going to try and understand the mechanisms behind a couple of grounding techniques, starting off with backward counting. You have a couple different types of backward counting. So one of them is where you say 5 and you look at your surroundings and you take in your surroundings. Then you go to 4 and you take in your surroundings and you understand your surroundings. Then you go into 3, 2, 1, the same way. Another one is from 50 to 1 with using 3 as a separation. So you would say 50, then you skip 3, you would say the next number, you skip 3 and so on. So what's actually happening over here is the brain is required to pay a lot more attention than it otherwise would in order to complete the task. Hence giving up its stance on anxiety and you get a little bit of relief. Moving on, we have jumping jacks also, which is a coping mechanism. Even push-ups are suggested. Now in order to understand this, we have to look at exercise. When you exercise, you release endorphins, which are the body's natural pain relievers. Endorphins interact with the pain receptors in the brain called opioid receptors. The opioid system is the body's natural system for regulating pain. Here we notice that the parts of the brain which register physical pain also register emotional pain, and that's why when you do jumping jacks, your anxiety goes down. Moving on to sensory incorporation techniques, there are multiple types over here. Some of them would be holding a piece of ice in your hand and focusing on the time it takes for it to melt, and focusing also on the sensation changing from cold to hot. Then there are other techniques also like picking up items in your home and feeling if they're hot or cold and noticing their texture, along with another exercise also incorporated into that. These are primarily also to set your brain to task, as we have discussed before. Moving on to brain talk. This is a new and interesting strategy. Here, whenever you start feeling anxious, just say, "Brain, I'm fine." In this, you're talking directly to your brain, or better to understand, to your subconscious. The subconscious regulates your body temperature, your heartbeat, your breathing. I mention subconscious here so that you understand the mechanisms that go into the working of your perception. Get back to talking about your subconscious in just a moment. Before that, let's just look at mindfulness and mindful meditation. Here you come to the realization that you do not have to be defined or follow your thoughts, your emotions, or your urges. You can separate yourself from them. Mindful meditation may help with this to a great deal. The goal is to keep your thoughts as thoughts, your emotions as emotions, and separate from you. It's been used in OCD treatment, and the life coach Brendan Bouchard has mentioned this a number of times actually. With practice, you should be able to keep unwanted thoughts and emotions as arbitrary satellites around you. Meditation, in fact, has been shown to decrease the size of the amygdala. So how do you meditate? Well, let's just say you clear your schedule for about 40 minutes. Select a good spot where you can just relax and sit down with no distractions. Sit in a relaxed position with your spine in the natural position. Close your eyes and relax your body. Calm your breathing. And after a minute or two of getting calm, focus on your breathing. Focus as your breathing travels slowly. Feel the sensation. And gradually shift your thoughts to the feelings of feeling your feet, feeling your shins, feeling your knees, and onward from that. Then gradually and gently letting that go. Focus on your thoughts. Feel your thoughts circulating around you. Don't interact too much with your thoughts, just let them circulate around you. And then try the same thing with your emotions. Don't interact too much with them, just let them surround you and just feel them hovering around you and hovering this thing. After a few times, you should be able to, without meditation also, incorporate this into regular mindfulness in your regular life. I did want to mention something important that was on my mind also, that emotions are emotions for a reason, and ignoring them over there can lead to complications. So if you do have a strong emotion, just throwing it out to the side over there would not be an answer. So it is important to remember that and later on confront that emotion and try and figure out why you did have that emotion. You can perhaps ask yourself questions like, why did I feel that way? What caused it? Have I felt that way before? What may have caused it? And so on and so forth. Try and confront it over there. It's not good to just throw out emotions like that. They can fester and they can lead to other problems later on. Bringing me to exposure. It's commonly used in therapies, and it's also a coping skill in OCD, anxiety, as well as PTSD. Your brain may try to warn you about something, and it might not actually make sense to somebody else. Challenge that. If your brain is telling you, take that spoon inside, someone might steal it. Challenge that. Leave that spoon over there. Your brain's going to start to realize that it's giving you the wrong signals over there. So what's actually happening here, if you try to understand it from a subconscious point of view, try to look at your subconscious as a 5 to 6 year old child, and an anxious 5 to 6 year old child, and reacting as an anxious 5 to 6 year old child would. And there you have your answer to why your anxiety is the way your anxiety is, and why your brain is acting the way your brain is, if you look at it from the point of view of your subconscious. Hence now you also understand why coping skills and even medications are just temporary relief. You have to fix, or you got to convince the scared child, which is your subconscious over there. And that can only happen for a more permanent solution with visiting a mental health specialist. And that's it for this episode of the Wayne Lemos podcast. Thank you for tuning in. Do look out for the last episode of this series, which is a heads up on treatment for anxiety and anxiety disorders. Till then, this is Wayne Lemos signing off. Thank you for tuning in, and goodbye.